Has your doctor ever advised you a thyroid scan? Do you know what is a thyroid scan? How do we do that? In which all condition it is performed and in whom all this scan cannot be performed? How do we interpret the results of this scan? Well, if you don't know, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr.Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. By the way, before I begin this video, a very important information. If you want to watch this video in Hindi language, then on the I button and in the description box, there is a link. You can click on that link and this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's begin our today's topic and that is the thyroid scan. Now the word thyroid scan is known by many other name also. Many people say that it is a scintillating scan. Many people call it as a technetium scan. Some people also call it a TC99M scan and some people also call this as a TC99M pertechnetate scan. Well, the names are different but they all are same. Now what is this technetium scan? See, this is a special kind of a thyroid scan which is performed in the nuclear medicine department. So you can say it is a nuclear medicine study. When we do this scan, we assess the activity of your thyroid gland. So that is nothing but this thyroid scan. When you have to undergo this thyroid scan, you need not usually get admitted in the hospital. Now this thyroid scan has a very interesting history of advancement. In the olden times, we used to use a radioactive iodine. However, this is mainly replaced by this technetium pertechnetate. Now, the reason why we use this technetium pertechnetate because there are many advantages. Very first advantage is that this scan does not become very expensive and it becomes financially cheaper. Secondly, it is very easily available as well as very safely this test can be performed. Another important point is that when you go through this test, the radiation exposure to your body is very less. And the half-life of this technetium pertechnetate is only 6 hours. And that's the reason why this extra of this chemical can be excreted and thrown out from your body very quickly. Another important point is that this chemical, unlike radioactive iodine, does not interfere with your thyroid hormone. So you can say that this all advantages are there and that is the reason why nowadays we don't do a radioactive iodine scan. However, it doesn't mean that those tests have been banned. No, those tests are still performed, especially when you have a thyroid cancer. In that kind of a situation, we use a radioactive iodine scan. Now let's understand where do you get these tests done. See, this test is usually performed in a nuclear medicine department of a hospital or a medical institute. This test is usually not performed in a private clinical setup. Important another question people usually have is that do I need to get admitted to do this test? See, usually you don't need any hospitalization. This test is performed as a daycare procedure and it usually needs maximum 2 to 3 hours time. Another important point is that do you have to undergo through any kind of an equipment? Now many people are scared of equipments like a CT scan and MRI. They have a claustrophobia. They get very scared when their body passes through such equipments. So don't worry, you do not have to undergo any such major equipments as such. So you can be rest assured and get these tests done. Now when this test is performed, you will actually come across through a team of medical experts. So first medical expert which will come in contact will be your thyroid treating doctor or an endocrinologist doctor who is going to evaluate you and will decide whether you need to undergo this scan or not. Secondly, you will need a help of a nuclear medicine technician who will be actually performing this test on you. And a third you will need is a nuclear medicine department doctors, radiologist doctors, who is actually going to interpret your results and give you the final report. So these are the three team of medical experts whose help you will need while undergoing this test. Now, in this test, we use a very special kind of an equipment, and that is a gamma camera with a pinhole stimulator. Many times, we also call it as a scintillation camera. Now, understand this thyroid scan is usually not a first line of investigation. So, when you suspect that you have any symptoms which is indicating for any kind of a thyroid imbalance, the very first thing you'll have to visit your thyroid specialist or doctor. They will take a detailed medical history, they will do your thyroid neck examination, and then further the doctor will advise you for the investigations. Based on what kind of a problem you have, your doctor will advise you the testing. So very first and the basic test we ask is a thyroid function test. It is a blood test. So in this we usually find out what is the level of your TSH, that is thyroid stimulating hormone, T3 and T4 hormones. Based on your medical case, your doctor might also ask you for a special kind of a test called as an antibodies test. Now these antibodies are usually anti-TPO antibody. Then we have an anti-thyroglobulin antibody and a third antibody, that is a TSH receptor antibody, also known as a TRAB. Sometimes your doctor might also ask you to undergo a ultrasound or sometimes even a CT scan based on your test. Sometimes your doctor even asks you to undergo through a test called as a thyroglobulin test. So all these tests are usually performed first. And if your doctor feels that you will get benefit after doing the thyroid scan, your doctor might ask you to undergo this test. Now let's see what are the indications or who are the right candidate for whom this test is advised. So the first one is that when we want to know the shape and the size of your thyroid gland. Secondly, if after your blood test we come to know that your thyroid gland is functioning less or more, to confirm that also we do this test. So when we do this test, we know that whether your thyroid gland is a hyperfunctioning, it is functioning more than the requirement, that is a hyperthyroidism, or it is functioning less than the requirement, that is a hypothyroidism. That also we will understand after this test. If we suspect that you are having a hyperthyroidism and you have a high functioning of the thyroid gland, we want to know what is the cause of this high functioning of the thyroid gland. Whether it is happening because of some inflammation of your thyroid gland called as a thyroiditis, whether it is happening because of a small nodule from your thyroid gland which is working more and producing more hormone. So to know that also we do this test. If at all you have any kind of a lump in your thyroid gland, and this lump is nothing but a nodule. So if you have any kind of a nodule, if we want to know whether your nodule is it a benign or a cancerous, that is a malignant, to discriminate that, again we will do this testing. If you have undergone any operation for your thyroid gland called as a thyroidectomy, where your thyroid gland is surgically removed, after such surgery also we do this testing. If in the past you ever had a thyroid cancer, in that kind of a situation also we advise you to undergo this test to make sure that do you have any metastasis or a remnant or a spread out of the cancer, then also we will do this testing. Many a times your thyroid gland grows and that we call it as a goiter, and many a times this goiter usually is not external but it is rather internal, and this kind of a goiter we call it as a retrosternal goiter. The word retro means behind, and sternal is nothing but the name of this bone. The bone what you see here, this bone is called as a sternum bone. So many a times this thyroid goiter grows internally behind the sternum bone. At that time also we do a thyroid scan to know what is the exact size and the extent of the retrosternal goiter. If for any other health problem, if you have undergone any other investigations like a chest x-ray, CT scan, MRI scan, PET scan, and after doing such scan, if there is any abnormality found, then in that case also your doctor might ask you to undergo further testing to check whether thyroid gland involvement is there or not. So in that situation also we do this test. Sometimes people have a disease called as a subclinical disease, wherein this disease is in the very primitive stage and the symptoms has not appeared. Sometimes the disease can be in the subacute stage. So in those kind of stages also we do advise a thyroid scan. Many times we also want to evaluate what is the distribution or a heterogeneity of the hyperfunctioning of the thyroid gland. In all such situations, we want to know the exact cause of your thyroid's activity, and in all these situations, we advise you to undergo this test. Now let's understand what are the contraindications of this test, or in whom all we cannot do this test. So very first contraindication is a pregnancy. We cannot do this test if you are a pregnant woman. Second relative contraindication is a breastfeeding. So if you are a breastfeeding or a lactating mother, we always advise you that you will have to stop breastfeeding for minimum 26 to 36 hours after underwent through this investigation. So during this time period, you arrange for an alternative nutritional requirement for your child. Either you can use the breast pump and express the milk, and that can be used, or use alternative measures to feed your child. Third contraindication is that if your body has any hypersensitivity or allergic reactions to radioactive iodine or technetium pertechnetate, then also you will have to be careful. If you have undergone any recent CT scan within 6 to 8 weeks period of time wherein any kind of intravenous iodine containing contrast media were used, then also you will have to wait for this time duration. Another contraindication is that if you have not stopped the medications which are high in iodine content, then also you will not get a complete benefit of this test and you will have to repeat the test. So these are the certain points needs to be kept in mind. Now let's understand how do you have to prepare for this scan. So you do not need a very special kind of a preparations, but these are the general guidelines which you need to keep in mind. So the very first and important point is that the interference of the iodine is a very high when we interpret the results of this scan. So this point has to be kept in mind, and that's the reason why we always advise a person to have a low iodine containing diet before undergoing this scan. If you are taking any kind of a iodine supplementation, then that also has to be stopped. Certain medications if you are taking for thyroid or other health problem, that also needs to be considered. So very first medicine is a levothyroxine. This medicine you will have to stop for minimum of 1 week prior for the scan. Second is a liothyronine. This needs to be stopped at least 5 days prior to the scan. Some people also take the medication contains the amiodarone. Now amiodarone is a high iodine containing medicine. This medicine is used for heart problems, and this is an anti-arrhythmic class of a medicine. So if you are taking this medicine, of course that also needs to be stopped. Usually we need to stop this medicine for anywhere between 3 to 6 months. But speak to your doctor, and whatever your doctor advises, accordingly you have to stop the medicine, and your doctor might advise you some other medication. Do not stop this medicine on your own, because these are the heart arrhythmic medicine and it can create a trouble. Another medicine is the lithium containing medicines. Now, the lithium containing medicines are mainly used for the mental and psychiatric illnesses. So, if you are taking such medication, you can speak to your doctor and your doctor might stop you or might readjust the dose or might give you other alternative. Some people also take medicines like carbimazole and propylthiouracil. Those medications also needs to be stopped. If you are taking any kind of an iodine supplementation, that also you will have to stop, because this iodine will interfere a lot with the result. So this point is to be kept in mind. Low iodine diet is always advised, and especially if you are having a lot of seafood, that consumption you need to reduce. High iodine containing vegetables like cabbage, cauliflower, broccoli, turnips, again their consumption has to be in a moderation to minimum. Another important point to keep in mind is that if you have recently undergone any kind of a CT scan within 6 to 8 weeks prior to this scan, you will have to wait, because during this scan many a times we use intravenous contrast agents, and this contrast agent will interfere with the result interpretation of your thyroid scan. Very important point is a pregnancy. This test is not performed during pregnancy. So if you are a childbearing age group woman, then you will have to make sure that you perform a urine pregnancy test or a beta HCG test to make sure that you are not pregnant. And if pregnant, this test cannot be performed. Another important point, if you are a breastfeeding or lactating mother, you will have to not breastfeed your child after undergoing this test for minimum 26 to 36 hours. So you can use alternative measures during this. So these are the general preparations you need to keep in mind. Understand this Understand this scan is usually not given as a first line of a investigation. Many times your doctor might have asked you to undergo a ultrasound or maybe a CT scan. So these are the testing which is usually performed along with the thyroid scan. Now let's understand how this test is performed. So see, you usually don't need any kind of a special precautions before undergoing this test. Secondly, you usually don't need to get admitted or hospitalized for this test. This test is usually performed as a daycare in the OPD process. This test is performed in the nuclear medicine department of the hospital. When you are going to travel, make sure that you carry all your medical records pertaining to your thyroid and overall health, and also carry all the medications which you are taking, whether it is of thyroid or whether it is not of a thyroid, because many a times the technician or the radiologist doctor over there would want to see this, so it should be there handy with you. Before undergoing for this test, at least minimum 4 hours you are not supposed to eat or drink anything and remain in the fasting state. This test usually takes around 45 to 60 minutes, but for a safer side, you make sure that you keep yourself free for at least 2 to 3 hours for this test. After undergoing this test, you can easily go back home and perform all your routine activities. After undergoing this test, you will usually not develop any kind of other complications. Now when you are going for the test, make sure that you remove all your valuable jewelries from your neck region, because this will interfere with your result otherwise. Secondly, make sure that you wear a very loose and a comfortable clothes, because during this test the technician will inject a special kind of a dye from your arm. So for that reason, we always advise you wear a loose comfortable clothes, and especially wear a half sleeve or a sleeveless clothes, so that this test becomes easy for you. During this test, you need not undergo through any kind of a machine or equipment. Many people have a claustrophobia and they get scared that how this test will be performed. Do I have to lie down in any machine or what? For how long I will be exposed? So don't worry. This test is very simple and very easy to perform. So now when your test will be there, the very first thing, the technician over there will explain the entire process to you, and the technician might even take the signature on a consent paper that you understand how this test is performed. Now your body positioning during this test is also very important. So you might be offered two of the position. The first position is wherein you will be asked to lie down on a medical bed in the supine position. Your technician might keep a pillow beneath your shoulder so that your chin faces up towards the ceiling. While doing this, we are exposing the maximum part of your neck region so that it becomes easy for the camera to capture the images. So this is the one position. If for any health reason you are not able to lie down, in that case they will offer you another position, and that is a sitting down position. Once your position is determined, after that the technician is going to place a special kind of a camera called as a scintillation camera close to your neck region. Don't worry, this camera is not going to touch your neck area. We usually keep a gap of a 20 to 25 centimeter. So once your body is positioned correctly, now the technician is going to inject a special kind of a radionuclide, and that is a sodium pertechnetate. For this, the technician will use your arm and will inject this chemical via the intravenous route from your vein. And what dose of the sodium pertechnetate will be injected will be decided as per your medical case. This scintillation camera is set to detect at what speed this gamma rays is being emitted. So based on that, it is going to capture the images. These images are usually obtained three images. The first image is an anterior image, second image is a right anterior oblique image, and the third image is a left anterior oblique. So we basically get these images. Now, many a times for the anterior image, we also use a special kind of a marker, and that is the sternal notch marker. While using this sternal notch marker, we also come to know whether the thyroid gland has any retrosternal extension or not, and we can detect the retrosternal goiter. So this is how this entire test is performed. Now let's see what is the radiation dose. So usually this radiation dose we measure in a unit called as a millisieverts. The radiation dose used in this thyroid scan is around 3.2 millisieverts. If we compare a CT scan, then the radiation exposure is nearly 15 millisieverts. And if we compare to a chest X-ray, the radiation exposure is 0.1 millisieverts. So this radiation is a little bit higher than the chest X-ray but lower than a CT scan. Now many people have a fear that what are the risks associated with this scan. See, this scan is usually considered as a very safe. There are usually not any major risk associated. Many people also fear that after undergoing this scan they are going to develop a cancer. So please do not worry about it. This test is a very safe and very commonly performed test. Now you have undergone the test. Now in how long time you are expected to get your results? Now see, it depends at what kind of a setting you have undergone this testing. Whether this testing is done planned or it is done on an emergency basis. Many a times it is also depends on the availability of the radiologist doctor also. Sometimes if the image is not clear, then in that case also you might need to undergo this test again, and you might have to repeat this test again. Usually this test is not given to you directly, but rather it might be given to the referring doctor. So once you refer that to a doctor, your referring doctor will advise you what is the test results and will be able to interpret the results for you. Now let's understand how these results are interpreted. See, the interpretation of the result is a very important, and the interpretation will depend mainly on the quality of the image. So if your images are perfect, your interpretation will become very easy and very accurate. However, due to any reason, if your images were poor and if they were blurred, this interpretation may become problematic and you might also have to undergo to this scan again. So when you are performing this scan, the right quality of the image is very important. Now many people are scared that this test is advised only in thyroid cancer. It is not like that. It is one of the indication, but it is not the only indication. Now how we are going to interpret the result, that's what we are going to discuss today. When we are going to interpret the result, we mainly come to know two things. First is what is the size of the gland. So if your size of the gland is very big, it usually indicates a goiter. Second point is the uptake of the sodium pertechnetate. The normal uptake usually happens if you have undergone any recent radioactive iodine therapy, or if you have a hypothyroid situation called as the Hashimoto's disease. If the uptake is increased or uptake is more, this is usually found in a hyperthyroid situation, and that happens mainly in the Graves' disease. It can also happen in a Hashimoto's situation. If the uptake is a less than the normal range, this usually happens if you have not stopped any the medication which interferes with this reporting. If you are continued the amiodarone, if you are continued taking high iodine diet or a high iodine containing supplements, then also the uptake can be low. Uptake can also be low if you have any kind of a subacute thyroiditis or a condition called as struma overi. In all these conditions, the uptake becomes low. Many a time this can also indicate us the abnormal location of the gland, and that's how uptake will become abnormal. And this usually happens in a condition wherein you have a lingual thyroid, or if you have any kind of a ectopic thyroid tissue. So these are all the uptake wise we interpret the result. Now when we are going to do the interpretation of the result, this is usually indicated in two ways. First one is the hot nodule. Now when we say the hot nodules are usually functioning, means they are making more and more hormone. And these hot nodules are usually due to hyperthyroidism, like a Graves' disease. In that kind of a situation, your treatment will move towards the Graves' disease or a hyperthyroid treatment. If the result interpretation comes as a cold nodule, also called as a non-functioning nodule, it might indicate a further investigation. Don't worry, 90% of the cold nodules can happen due to benign conditions like adenoma or thyroid nodules. Only in 10% situations it can be due to thyroid cancer. However, once we know it is a cold nodule, of course you will have to undergo a further investigation to find out whether this cold nodule is a cancerous or non-cancerous. And to confirm that, your doctor might advise you to undergo a test called as an ultrasound or maybe a FNAC, that is a fine needle aspiration cytology. This FNAC test is usually considered a very important test in a diagnosing of a cancer. Whatever may be the interpretation and the problem, your doctor is going to advise you the treatment accordingly. Now when the camera is capturing the images, you need to keep in mind that you please don't move yourself. Many times people move and that disturbs the quality of the image and the images comes blurred, and in that case you might have to repeat the test again. Also, do not try to swallow or gulp any kind of a saliva while the camera is capturing the image, because again this will make the poor quality images. So please make a note of that. So this is how we do this thyroid scan. So we have seen today how do we do that, in what all conditions we do it, and where it is not performed. If at all you have done this kind of a thyroid scan in the past, or if your doctor has advised you, please write in the comment box. If you have any question pertaining to your thyroid health, please leave your question in the comment box. I will try to answer them as early as I can. If you have not subscribed to my channel, please subscribe so that you will get more and more health related information. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification. And if you found some good useful information, please click on the like button. We will meet again in some other video with some new interesting and useful topic. Till then, take care of yourself and namaste.